Oral questions. La période de questions orales.
Oral questions. I recognize the leader of the official opposition. Thank you, Madam Speaker. Good morning to you.
Yesterday about the government's claim that they have delivered 7 new clinics. Having learned the horrible truth about the Premier's 10,000 jobs pledge, which resulted in the creation of only 3 jobs, including 1 for herself, I have no confidence in the Premier's math skills. Does the Premier stand by her claim of 10,000 patients coming off the wait list? Thank you, Madam Speaker.
Je reconnais la Première ministre.
Merci beaucoup, Madame la
I recognize the Honourable Premier.
for the question, and I really have to say I appreciated yesterday how the member opposite went through and detailed in his reply from the speech from the throne each of the clinics that we have expanded or created new and supported, each of the thousands of patients that we're taking off of the waiting list for care. So with the 7 clinics that we have created, invested in, expanded, added new doctors to, new nurse practitioners, as you've just heard, social workers, dietitians, pharmacists, the whole team of healthcare professionals in New Brunswick is at work, and with those 7 clinics, more than 10,000 people are coming off the waiting list for care, and there's going to be more happening this year, so thousands more New Brunswickers are going to get off that waiting list and get access to what they have been asking for most, and that is better healthcare close to home. Our government is delivering it.
I recognize the leader of the official opposition.
Well, thank you very much, Madam Speaker. It seems like we're getting somewhere here when it comes to getting some real facts out of these Liberals, because she's talking about expanded when the promise was new, right? Clinics, now it's family health teams. So we're getting there. I don't know if we'll be able to get her to actually say 10 new clinics all at the same time, because I think she's got a mental block with that now. But this comes down to credibility, Madam Speaker. People have to be able to believe what government is saying. That's why I helped remind the government members of the importance of being transparent with journalists. It was a service that I was glad to provide, Madam Speaker. This government is losing credibility faster than it is losing school librarians, because they have promised things they cannot deliver and are failing New Brunswickers once again. The 10 new clinics the Premier has promised are supposedly taking 10,000, now 7,000, off the wait list. Can the Premier explain where she got her numbers from and why she is mixing aspirational and real targets?
I would like to recognize the Premier.
Merci beaucoup, Madame la Présidente. Oui,
Thank you, Madam Speaker. Yes, I'm pleased to have the opportunity to repeat the great work that the Department of Health did, our great team, and all of our partners in our health networks, Vitalité, Horizon, and also in communities. We have healthcare professionals who asked for help. They wanted to be there, and the former government had no flexibility to include them in the system, but we decided to open up new clinics in Campbellton, Miramichi, Moncton. We added new family doctors in Carleton North, also more access for family medicine days and nurse practitioners in Tentramar, new nurse practitioners, and a new service in Namek. We have a new space with 2 new family doctors in Fredericton North, and we added this service, and we created a new collaborative healthcare model to improve. I recognize the leader of the official opposition.
Not what I asked. Can the Premier explain where she got her numbers from and why she is mixing in patients who already had access with aspirational targets? She's promised 10,000. She's saying 10,000 are coming off. She promised 10 new clinics. We're getting into the details here. Why did she mix people who are already getting service with aspirational targets to get to her 10,000 number?
Je reconnais la Première ministre.
I'm happy to explain further. I really appreciate that the member opposite wants to spend time talking about the most transformative thing that this government has done, which is build a model of primary care that is flexible, that includes doctors and nurse practitioners, technology-supported administrative support. So we have increased the supports and created new clinics to allow 1,600 new people to get access to care in Fredericton North, 3,500 new people to get access to care in Lamec with the expanded services they're delivering, 1,000 people in Tantramar, 800 people in Carleton North, 2,000 people in Campbellton, 1,000 people in Miramichi and Norden, 700 people in Mapleton, and if you do the math, that adds up to 10,600 new patients taken off the list.
I recognize the Leader of the Official Opposition.
The Premier is leaving the impression, Madam Speaker, that these people are getting this health care now, and they are not. The Premier has complained that things often do not go fast enough to suit her. Since the Premier loves metrics, it is strange that she has not provided any concerning the uptake, the actual uptake in these clinics. Considering her background in the civil service, she should have known how long it would take things to get done. What does she feel is an acceptable time for these people to get connected to a doctor? Is it 1 year? Is it 2 years? Is it longer? Or does she have any timeline at all?
I recognize the Premier.
Thank you, Madam Speaker. I'm so glad the member opposite asked about timeline, because I can remember sitting where he was sitting and reading speeches from the throne from the previous government that committed to 4 collaborative care clinics, and they made that commitment in 2022, and then in 2023, and then in 2024, and not one of those 4 clinics opened over the 3 years that they were promising them. Our government made a commitment to open 10 clinics this year. We got right to work, and in 7 months have opened 7 clinics, and before the end of this year, there will be 3 more, if not 4 more clinics to make 10 collaborative clinics open in different communities across this province so that more New Brunswickers can get access to primary health care close to home, the thing they were asking the previous government to do. They didn't deliver even though they promised to. Our government is meeting that commitment this year with 10 more next year, and we're going to meet our commitment of 30 until we connect every New Brunswicker in this province to a collaborative care clinic close to their home.
Leader of the Official Opposition.
I was wondering when she was going to show up. Good old rear view Sue, Madam Speaker. This is a government that avoids responsibility at all costs. Whether it's blaming the EUB for the cost of carbon adjuster, blaming librarians for literacy scores, or blaming DECs for not knowing their budgets were negotiable, who will the Premier blame or hold to account if these teams do not reach their aspirational targets as described in government press releases?
I recognize the Honourable Premier. Thank you, Madam Speaker. Once again, I appreciate the accountability question that was asked, because our government thinks that it's a priority to be accountable regarding our actions and our work. In the state of the province last January, we presented 15 measures so that New Brunswickers can make us accountable related to our promises, and it's up to us to deliver those services. We had one promise for healthcare, and one was access to primary healthcare and to be connected, and this number was reduced from 95% to 67% for the previous government, but we will increase this number thanks to our work and to make it so patients have access to those community health care teams. So we will make sure that New Brunswickers are connected to those new nurse practitioners and family doctors here in New Brunswick.
Recognize the Leader of the Official Opposition.
Thank you, Madam Speaker. Patients waiting 2 years to access clinics is unacceptable. She promised transformational change. She said that health care is in crisis. This crisis needs solutions now, which this government promised to deliver. She promised better. Does she think that people waiting 2 years, which were sourced from her own government releases, does she believe that 2 years to wait for access to health care is acceptable?
I recognize the Minister of Health.
Thank you for the opportunity to rise today, Madam Speaker. Yes, 2 years is a long time. Waiting in the emergency department for 12 hours is a long time, and it is unacceptable. We are working very hard to reduce those. You don't hear from the senior that saw their new family doctor in Nordine yesterday. You don't hear from the 22-year-old person that has a significant problem that's not in the emergency department because they saw their new family doctor in Miramichi. So this is what does new mean? Well, I moved houses a few years ago, and to me that's a new house. When we take a clinic that has one doctor today and turn it into a clinic that has 3 doctors, 2 nurse practitioners, a bunch of nurses, that's new to me. And we are doing that all over the province. Thank you.